Hi. So I want to clarify something. I want to clarify what I call muscular shin splints versus actual bone shin splints. What I talked about on the podcast was the MTSS, medial tibial stress syndrome. I talked about how that's a bone bruise. There's also another kind of classification that we'll call shin splints that I like to refer to as muscular. And the good news is it doesn't have to do with the bone. It's just an overuse of the muscle. And so how you can differentiate the two is one is the location. The location can tell us so much. So if the location of your shin splints is towards the inside lower part of your shin, towards your ankle and above, that's more bone bruise. Now if your pain is located just below your kneecap towards the outside, and you can feel when you do that drawbridge motion where we call dorsiflexion, where I'm folding at the ankle, you'll feel that muscle contract. If that's the location of your discomfort, and especially if you feel it just doing this and that's your spot, that's a lot easier fix. That's almost always postural related. That muscle isn't really prepared and meant for being active for thousands of repetitions. And so our posture, the ankle, can dictate us to not have to use it as much. So the two most common causes are either someone that is vertical running forward, so they're essentially leaning back, they're going to have a greater distance between the forefoot and the ground. The greater that distance, what's controlling that is that muscle, the tibialis anterior or the muscular shin splints. By working on differentiating, one, is it muscular versus bone bruise? The podcast last time was all about the bone bruise or MTSS, and the muscular one is all about addressing the posture, leaning forward at the ankles, not at the hips. So please let me know if you have any questions. Let me know.